record will be retained on the council website. For those of you who are viewing at home, the webcast, I will inform you that if you look above the video, you will see a resources tab, and if you select this, a link to the agenda will appear on the right-hand side. This will help you to open the agenda in PDF form and follow the discussion and the debates. I would now like to ask the Legal Services Officer, Vicky, if you could undertake a roll call of all the members, please.
Yes, Chair. Good evening, members. If I could ask you to turn your cameras and microphones on and just identify that you're present at the meeting. So, Councillor Berry?
Yeah, excuse me, yes, present.
Councillor Burgess-Joyce?
Good evening, Vicky, present.
Councillor Collins?
Evening, Vicky, I'm present.
Councillor Cottier?
Yes, good evening, all here.
Councillor Frost?
Evening, everyone, present.
Councillor Gilchrist?
Good evening, everyone, present, thank you.
Councillor Cannon?
Good evening, thank you.
Councillor Jordan?
Evening, Vicky, present.
Councillor McLaughlin?
Good evening, Vicky, present.
Councillor Usher?
Evening, Vicky, evening, everyone.
Thank you. I think that's everybody in the committee present, Chair.
Right. Do we have any apologies?
I'm not aware that we have any apologies for absence this evening.
And if we would note that Councillor Cannon continues to deputise for Councillor Sharon Jones. Has anyone got any declarations of interest? No, nothing.
Chair, yes, I have. Sorry.
Yes.
I've got a daughter that works for the NHS.
Thank you, Councillor McLaughlin. Councillor Cottier?
Yes, thanks, Chair. I'm a director of a construction company that takes part in contracts with NHS.
Thank you, Councillor Usher.
Just like to declare an interest by virtue of my employment through a registered care provider.
Thank you.
Supported living service. Thanks.
Thank you. And I should, just in case, I should declare an interest. My son works in one of our testing centres.
Chair, so I've got my hand up as well.
I'm sorry, missed you there. Sorry, Mary. Yes.
Yes, thank you, Chair. I work for the NHS. My son works for the NHS, and I'm a trustee of Incubabies.
Right. Thank you very much. That
Chair.
And you, yes. See you there, Councillor Collins, yes.
Yeah, thanks, Chair. I'm on the board at the Wirral University Teaching Hospital Trust, and my daughter works for the NHS.
Thank you very much. Okay, I can't see any more hands. Oh, yours a legacy hand, Councillor Jordan. And Councillor Collins.
Put it down.
Legacy hands, right. That's lovely. Right, then we'll move on to item 3 on the agenda, which is the minutes of the last meeting. Anyone have any comments in respect of accuracy? Those minutes of the 18th of January, that is. Right, so we have no comments. I'm happy to move those minutes as a true record. Can I have a seconder, please?
Seconded.
Thank you. Right, public and member questions or petitions. Do we have any, Vicky?
No, Chair, there are no public questions, no public statements, and no member questions that we've been notified of.
Righty-ho. Oh, well, nobody's interested in this time.
I don't know whether any members have any petitions you might wish to ask.
No, I think everything was sort of dealt with at Budget Council, wasn't it? Right. So then that brings us on to item 5, which is the extra care housing model. Did you want to speak to this one, Graham, or is it somebody else? Oh, it's Simon. Hello,
Good
Simon.
evening, Councillor Nolan. Good evening, members. So I'll address this paper, and this is a revised model. So there is a history in former cabinet reports around the model for extra care. Things have moved forward significantly since that was presented several years ago. And what we wanted was to update the model. And the model is there to articulate our expectations from the market in terms of providers of social housing, providers of care that support that approach. And so people are clear about what we're looking for when they come with a proposal around extra care housing in Wirral. So it's essentially about updating and providing a common reference point going forward for both those who use those facilities, use that type of care and accommodation, and also those involved in developing or providing it. So it's really updating what's there. Happy to accept any questions about it.
Yeah, I mean, my comment is I thought it was a very useful document, and I could see, as I was reading it, I thought, well, that must be really helpful for developers. But I'm sure other people have got questions. Anybody else? No?
Not a question, Chair, but I would like to endorse what you've just said there, that it's really good to see that there's going to be a very clear set of standards laid out for people who want to develop this sort of housing. I think we all accept that certainly we've got a need for it, but only of the standard that is of the highest. And this does put that model in place. I welcome this.
All right.
Thank you.
Thank you, Councillor McLaughlin. Councillor Gilchrist.
Yeah, thank you very much, Chair. The paper does have a paragraph about location and talks about the core strategy local plan. It may be that as we get this booklet or highlight this booklet or promote it to developers, they come forward. My interest, Chair, has always been having a pipeline of sites that we might have in mind. A location, a distribution of places like this across Wirral would be very useful for relatives, but also it has to be in places where there's demand and where there are particular needs of people. So in addition to this booklet, I would like us to give thought, because over the last 2 or 3 years, each time I've asked about extra care, I've asked Simon Gardner about which sites have we got, which sites are in development, which sites have been delayed, which are in the pipeline, that kind of questioning, so that perhaps if developers do come forward, we can be kept appraised, because I'm sure I read a figure somewhere which said that we were planning to have up to 3,000 places by a certain date some years ahead, and we've reached several hundred. Now the purpose of the help, all these schemes, reduces sort of say lots of calls that lots of staff have to make to lots of different locations. If there's a group of people who are being looked after and socialising and mixing and being cared for in this setting, but they've got a high degree of independence, that's very good for them and very good for their development and retaining their faculties. So the point is, I come to it now, we need an idea of what a target might have to reach an extra number of places over a couple of years, so we can work towards it and plan ahead. And that might mean thinking about our capital programme as well, of course, so that things, let's say, put it simply, the ducks are in a row, and when something comes up, we can move on it. I hope that explanation made sense, Chair.
Yes, it absolutely does make sense, and certainly sites are one of the things that concern me. I've already highlighted to Councillor Leach that in respect of the role of our Regen and Economic Development Committee, that when land does become available, that they make sure that we're made aware of that, so that we can be talking to developers and, if you like, get first dibs on any land which maybe would have gone to the growth company but perhaps isn't for whatever reason or another going to the growth company, that we're made aware of that. So I've already asked that question, and in fact I think I'm hopefully going to a meeting tomorrow along with Simon, where we're looking at a piece of land. So right, Councillor, I'm sorry, I don't know the order in which you came up. Councillor Cottier, and then I've got Councillor Usher.
Thanks, Chair. Yeah, it's just a question around control of construction, really, because obviously this model sets out what's required in the new construction, but who's, to honour the building regs, you'd have an old building control left, an old council, and now it's obviously private as well. But who would honour that the model's being adhered to? Would it be CQC coming in afterwards to sign it off? Would there be certification? And who is in control of that, basically? Who would be like the de facto building controller, making sure that this model is honoured, rather than just at design stage, actually right through to completion and operation and maintenance, if that makes sense?
It does. Is it okay to respond?
You respond to that, Simon.
Yeah. So in terms of regulation, the care provider that we commission for extra care housing sites is taken from our framework, which means that they are CQC registered and meet our standards as contractors of that care that's on site. In terms of the building and the provider of housing, the social landlord, they're also obviously regulated. But what we do is we join up the approach. We have a strategic care and accommodation board that pulls together representatives from rents and benefits, housing and care and social work to discuss these developments and ensure that they are following a particular route to make sure they're compliant with the model that we've got. So yes, there's a means of not just seeing that at the outset, but managing that going forward as well. And if there are issues raised about standards, we have designated officers we would bring in to look at those issues from the relevant department. Just referencing Councillor Gilchrist's point, it's the social housing market analysis, I think, where you've got that figure about the future and what we should be looking to commission around extra care housing. But there is ongoing local work about location as well. You're quite right, it does need to be something that's considered in terms of where we grow extra care housing in the borough.
Thanks for that. Councillor Usher.
Thanks, Chair. Yeah, just a similar point, really. Obviously, we're all, I think we're all on board when it comes to agreeing there's a need for this type of kind of housing, and the model references specifically, that consideration in terms of how close certain sites are to communal facilities. That's key, and I suppose the what I'm driving at here is it's not just the focus is firstly on a setting within a communal setting or in a community setting as opposed to an old style care setting. One step better than that is to have access to facilities of this type in their community, not just a community. So I suppose having knowledge of the sites is a key part of being able to ensure that there's supply of this within the communities of the people who are likely to use them, not to simply focus our extra care housing within an area where, say, for example, we've got low land value, etc., which will come with its own problems. But just a kind of just wanted to make that comment. Really, is a community setting's great, but a setting within their own community is another step better, and just really, I suppose, nails what extra care housing is all about. So that's my first comment, and then just my second comment as well is, you know, obviously there's some fantastic examples on the Wirral of good quality extra care housing with lots of integrated facilities, and there's a project up in Fife where they've just built a kind of a really high quality site with some extra care housing as well as a home, but also with nursery and creche facilities as well. And I think looking for those opportunities where where we can integrate those family facilities with older people's facilities will have some really profound health benefits for the people who are accessing those services. So just those two comments really, Simon, and whether those two things are being considered and if there's any opportunities in the pipeline for those things. Thank you.
Thank you, Councillor Usher. Well, just so happens in Rockferry, work has just begun, spades just in the ground on an extra care housing development, which is an extra care housing development alongside a housing development of family houses, a mix of different types of family houses, some affordable rents, some for purchase, so a good mix of housing types, all on the same site as an extra care housing facility that has a bistro, a coffee bar, open to the public, a hairdresser, etc. All those facilities. So, Councillor McLaughlin's got something to say on that one too.
Well, I would do, wouldn't I, since I was there right from the very start when any kind of development there was so severely objected to by pretty well all the residents at that time. But over time, the residents have worked so closely with the council officers in the first instance, the developers now, even to the point where they're still keeping an eye on what's going on and making sure it fits in with what they expect. But you know what? Between a lot of them, they've come up with a wonderful plan for that area, which was a derelict site, and there's still an area of green space that's left for community use. But it is exactly what you'd look for in a development where older people with care needs are going to be right in the centre of a development of with families and facilities on the site, and it's just exactly what I would have wanted to see on that site. So I'm very pleased about it, and I'm sure Councillor Nolan is as well. It is going to benefit the area tremendously. In fact, I'm saying it now. I want it called Moira McLaughlin House, if you don't mind.
Oh, I'll see what I can arrange.
All right, we'll call it McLaughlin Nolan House if you like.
Absolutely. You want me to book you a place in there as well, Moira?
But you know what? Yeah, actually, I'm getting that way. Yeah.
Okay. Right. Any other comments? Anyone I've missed? You can come back on this, aren't you, Simon? Yep. Okay.
Okay. So it was just to say, yeah, there's some recent research around what's termed right sizing, and the sort of location distance that people move from and to, which is variable, but there's I suppose a predominance of people moving within a reasonable sort of 5 to 10 mile radius from their current home to something like extra care, because I think that the very reasons you've outlined, it's about being community focused, isn't it? It's about being able to keep your ties and your activities that you enjoy and the relationships as much as possible. The tension can be that sometimes people are seeking for family support as well, and that might not be in the same place. So we try and get that balance there, that balance right for people. But again, it comes back to getting the location right, getting spread across the borough, and making sure that where we're locating extra care is close to community facilities.
Okay, thanks, Sam. That's really helpful. Any other comments?
Chair, can I just confirm who was seconding it? Is it Councillor McLaughlin?
I have seconded it. Yeah. Okay, happy to do that.
Okay, no objections. That's great. We'll take that by assent. We've agreed that. That moves us on to the next item, which is the extra care tender. Is that you as well, Simon?
It's me, Councillor Nolan, Jane Marshall.
Aaron. Oh,
Hi.
hello.
Hi, I'm Jane Marshall. I'm the Lead Commissioner for the Community. Current extra care schemes. That includes Harvest Court in Morton, Willow Bank, of course, Lane in Wallasey, Granville Court in Wallasey, Mendel Court in Bromborough, and Cherry Tree House also in Morton. The recommendations that we're asking for is that the committee agrees for the procurement process to take place for the care and support contract in each of the extra care housing schemes listed above, and that the committee gives delegated authority for the Director of Care and Health to award the tender to the successful bidder following the tender process. We had options available to us in terms of which framework we use. We opted to use the Liverpool City Region framework flexible purchasing system. That means we can call on providers from all across the Liverpool City Region, and all of our current providers are also already registered on that system. The current number included in the tender units of extra care is 250, and that is spread across those 5 named schemes. We're intending to start the procurement exercise, if we possibly can, on the 8th of March and conclude that in May, so that we can start the contract award date in June. We would like to award a 5-year contract, and we'd like to maintain the existing model and banding for charging in the extra care scheme. All the evaluations, because the providers will be on our framework, will be evaluated on 100% quality because the rate has already been agreed. And we've listed in the report the total amount within the contract that will take it over the 5-year period. And we've previously done engagement via the chest, so all the providers are aware, and we have worked closely with the providers and the Liverpool City Region in terms of communications, and also the timings in relation to this report coming to committee. That's.
Thank you for that. Questions to Jane? Councillor Cannon.
Thank you, Jane. I was just looking at the procurement process, and I'm sure it's a question that the members will all want. Is what KPIs are in place for that, and what Q&A once the procurement's done? We're offering a 5-year contract, so what do we have in place to report back to ensure the quality?
Yeah, we have a core set of KPIs that we work with that are included in the specification for the contract, that are around continuity of staff for the people there, timeliness of visits, etc. That's in there. They are monitored by both our contracts team, and any providers that do have any slipping standards are referred via our quality improvement team, who intervene and help them get back to the standards that we require of them. So we've got both contractual and quality arrangements in place to monitor the service that's delivered there.
Thank you, Jane.
Thank you.
Councillor Collins, then Councillor Burgess-Joyce.
Thank you, Chair. Good evening. Just about the real living wage, you've put in 4.4. If the successful provider doesn't commit to paying the real living wage, they won't receive the enhanced rate agreed by the committee. Surely I would have thought that if they're not prepared to pay the real living wage, as a council we've been pushing that forward, that they shouldn't even be included in the tendering process. Now, that may be me being very naive, but couldn't that be part of the tendering process, that they must pay the real living wage? We pushed for it as council, we've all agreed it, and I think it's quite right that we should be doing that.
Yeah, I think that could have been an option for us to include in the paper, but when we look at our existing providers that are already on our framework, they've all signed up to the real living wage for our domiciliary care provision. So I think of the organisations that will tender, they are already signed up.
I would actually like to see that actually put in the tender. I don't know if the rest of the committee agree with me, but I think I would like that actually in the tender, that they can only tender for it if they are paying the real living wage. I know we have some who've signed up for it, but you've got to get out for people who don't do it to actually tender. I think really as a council we've pushed it, and I think we should actually have that in the tender. Thank you, Chair.
Are you making that as a proposal? So hang on, Jane.
Yeah.
You're making that as a proposal, Councillor Collins?
I didn't realise I could, but I would be happy if that's all right, Vicky. But
just need a seconder.
Councillor Collins, I'm not a contractual expert, but I think there may be some legal issues in relation to that. I'm not sure whether legally we're able to do that. So, but certainly I can get one of our contract lawyers to give.
Second that, Councillor Nolan, as a motion from this committee pending legal advice.
I was going to say, could it not be phrased in such a way as legal advice is sought as to the prospect of the possibility of asking for providers to pay their staff the real living wage? Could it not be crouched in those sort of terms?
I would suggest it's something. Yeah, I think you're right. I think it's something like the committee would wish to see. This being paying the real living wage to be a part of the tendering process, and legal advice will be sought.
Yeah.
I think there is a report about the real living wage that is coming to Policy and Resources Committee. I think at the next meeting, which will fully explain all the implications in terms of that in relation to tendering and contracts that we award. But we can obviously advise in relation to this particular issue. Yeah.
Well, the committee can wish to see that, if that's what the committee wants to do. I'll take that motion at the end of this discussion. That we've got a few other hands up now. Councillor Burgess-Joyce was next, then Councillor Usher, then Councillor Gilchrist.
Hello, Jane. Thank you very much for that presentation. I'm sure you got this covered, but it's just something that's always been a bit of a concern to me around a catastrophe cover. I noticed that most of the extra care homes are with Housing 21, which I appreciate is a large entity, but it is a charitable entity. And I'm just wondering what kind of protections do we put in place to ensure that if one particular provider who covers us for a large service were to fail, how would that be covered? Because I'm just conscious that's a big fail if it ever happened. I'm not saying necessarily specifically Housing 21, but it applies to all things that the council may go down in the care sector. So did you have something that you could explain to me as an ignorant layman what you do there?
Sure. So Housing 21 is the registered social landlord for the schemes, and with Liverpool Housing Trust, and the care provider is a different provider. In relation to this award, what we're saying of the 5 schemes, that our preference would be that one provider does not achieve more than 3, so that we can spread the risk across the market.
Right. Thank you very much, Jane. Forgive my ignorance.
That's okay. Happy to answer.
Thank you. Thanks, Chair.
Thank you. I've got Councillor Usher, then Councillor Gilchrist.
Thanks, Chair. I'd just like to seek some advice, really, on the motion and whether whether I'd be able to take part in that vote or not. Vicky, I'm not sure whether you have any advice by virtue of my employment. in a supported living service, which obviously may or may not decide to take that offer up.
I think we have advised in the past, Councillor Usher, that you have a pecuniary interest in that situation, and therefore you wouldn't be able to vote.
Understood.
And would need to leave the room.
Understood. Thank you, Vicky. Thanks, Chair.
Right, Councillor Gilchrist, then Councillor Frost.
Well, thank you, Chair. I think the key issue is this, that even the present government, at the probably early last summer, when they really wanted to say that care and health should be both thought of as a career, the government was saying that they want to bring people into care and recruit people to work in care, and they wanted a real career structure so that it was seen as something attractive to go into and worthwhile. It would strike me that it'd be very odd if we weren't able to persuade any of the applicants that we want the real living wage, because we want it to be a profession, a vocation, calling whatever term you put on it, that people see it is something to go into and can give themselves to and provide service through, and actually be respected by society and paid the right wage for doing it.
Could I respond?
Well, by all means, Jane.
Yeah, I think, yes, of course. Yeah, I think it was in terms of timings of the budget committee and this committee that actually the budget hadn't been approved at the real living wage rate. So it is something that we can take advice on from our legal team. So
lovely. Thank you for that, Councillor. Who was next? Councillor Frost.
Thanks, Chair. My two questions have been covered. I just wanted to share my perspective. I'm very much in favour of the living wage conversation as well. That was going to be one of my questions, and my other was Councillor Cannon made around performance monitoring and tracking. So it's really helpful, Jane, to get an understanding of the process that you're taking it through. Thanks, Chair.
Thank you.
Thank you. Are there any more questions? Councillor Burgess-Joyce, is that a legacy hand?
Sorry, forgive me, Chair. I'll take it down. Thank you.
Thank you. I can't see any other hands. Have you got any further comments, Jane, for the committee?
No further comments from me, Chair.
Thank you. That's very helpful. What are we being asked to just agree the start of the tendering process?
Yeah, I think we're agreeing. We've asked that committee agrees for the procurement process to take place for the extra care, care and support contract, and that the committee gives delegated authority to the Director of Care and Health to award the tender.
I knew there was a second bit. I knew there was a second bit in there somewhere. Yes, that's right. So before I come to Councillor Collins's proposal, I'm going to take the proposal that's in the report. Right, so can I have a proposer and a seconder for the recommendations?
I'll propose that, Chair.
Thank you. And a second?
I'll second that if you want, Chair.
Okay, thank you very much. And we have Councillor Collins. So that's, we agree the recommendations, the tendering process and the delegated authority to the Director. And then we have Councillor Collins' proposal, which, as I understand it, we're now going to word as this committee would wish to see that one of the criteria for being eligible to tender for the extra care housing would be that the provider was paying the real living wage, and legal advice will be sought on the feasibility of this. That was proposed from Councillor Collins, and
I'm happy to second that if that's not been done already.
Well, seconded it, Phil. If you want to third it, you're very welcome.
Great minds.
Thirded, please note it was thirded by Councillor Gilchrist. Okay, so first of all, on the recommendations, is everyone in favour? Any objections on the recommendations? Councillor Burgess.
So it's just a query, please, Chair.
Yeah.
I'm actually all in agreement, I have to say, with Councillor Collins' comment. Will it make it difficult for us, though, do you think? I'm probably asking you and Jane, because you've both been in that world, but will it make it difficult for us to get a wide range of providers coming forward for procurement if we restrict on a particular point? I'm just curious as to whether we might be cutting off our nose to spite our face, even though we all agree that we should be paying the living wage.
Well, I mean, I'm going to ask Jane to comment on that in a moment. I would only say off the top of my head, no, because as Jane's already said, all of the providers are already signed up to the real living wage. But we've got the director with his hand up, so we'll take his comments now.
Thanks, Chair.
Thank you, Chair.
Okay.
In terms of the wording, I mean, I completely support what elected members are saying here, but in terms of the wording, it may be that some providers do not currently pay the real living wage, but would wish to tender on the basis of paying the real living wage. So I think that would help us in terms of the pool of providers, that would be interested in delivering this service, but also the pool of providers that will be paying the real living wage. So in essence, where we are tendering, we would be tendering on the basis that the real living wage would be paid by the provider to their staff. And then it is for them to decide whether they want to do that on the basis of this tender or not, depending on what their reach is.
Right.
Thanks, Graham.
Hope that helps.
Thank you, Duff.
Thank you. That seems to make perfect sense, and I will leave that to our committee services to put that into the right form of words. So is everyone, all committee members, in support of that proposal from Councillor Collins?
Yes, agreed.
Anyone against? No, can't hear any dissenting voices. Okay, so we've agreed that. So thank you. Thank you very much for that, Jane. That was really helpful to be aware of that. And that then moves us on to Healthwatch, I think.
Hi, yeah, it's Jane again, Councillor Nolan. This item on the agenda looks at the recommission of the the Healthwatch service. The report highlights the council's statutory duty to have a Healthwatch function, and that's set out within the report. In terms of recommendations, what we'd want is that the committee approves the tendering process for the local Healthwatch and also the Independent Health Complaints Advocacy Service, and that committee gives delegated authority to the Director of Care and Health to award the tender once the procurement exercise is complete to the successful bidder. The local authority has a statutory duty and responsibility to contract the provision of both a local Healthwatch service and also a Healthwatch advocacy service. We are aiming to get the procurement out in April, if in March or April, if we possibly can. And what we'd like to be able to do is to award a 5-year contract, which would total 170,000 a year for the Healthwatch service and 90,000 over the 5-year period for the health advocacy scheme. We do, of course, as you know, have a current Healthwatch provider, and we have made sure that we've written into our local arrangements that our tendering specification that there's a strong link to officers, etc., on the Wirral in terms of social value for the council. So happy to take any questions.
Okay. I think my first question is I am aware that we have a legal requirement to commission a Healthwatch service. Do we have a legal requirement to regularly go out to tender?
I have taken advice from our procurement specialists in the council, and they have advised that we do need to tender at this time. What we are requesting though this time is that we have a longer life contract of 5 years included as part of the arrangement.
Okay. Okay. Right, I'll leave question. I'm sure others have similar questions to me, so let's throw that open to members then for any questions for Jane on Healthwatch. Councillor Cannon.
Thank you, Jane. I think my question was just around the financial side of things. Obviously, I don't have anything to compare that to from previous budgets. So is that, or maybe the director needs to answer, is that the amount that we're expecting? It says that we have budget provision within adults for that, but I was just checking that that was the sort of amount that you were expecting to send this out to tender. Thank you.
Yes, it comes into the council in the form of a grant with an indication. So that's the amount that we would expect that tender to come within.
That's great. Thank you.
Councillor Burgess-Joyce.
Thanks, Chair. Just very briefly, I appreciate the legal requirements, Jane, but it's a phenomenally large amount of money. I mean, what exactly are we getting it as an end result for that kind of money, given, you know, we had the budget council yesterday and obviously money's tight. What exactly do you get at the end? What's the end product for our 850,000 over a 5-year plus another 90,000? So it's an awful large bill. Does it actually add value, Jane, or is it something we just have to do?
We do have to have a statutory service, and I do have to say our Healthwatch contractor currently works very, very closely with us and have been very greatly involved right throughout the pandemic in terms of independent and objective oversight of the services that we provide. They are very close to our quality team, providing information and advice. They've recently been working very carefully with us on reports on care home visiting. They provide independent advocacy for people that have been experiencing difficulties accessing health services in relation to hospital or community health treatment or GP treatment. So they have, in terms of the specification, a set of people's user experience. They've also recently set up a new independent website where people can give feedback on the services, both for health and care, that they're providing. So they do provide a big wide range of services and also provide advice and information back into commissioners and contracts managers in terms of both the customer and the carer experience of our current commissions.
So, sorry, Chair, just one clarification. So, do they provide a number of dedicated staff to Wirral, or is it like a shared service almost?
No, it's a Wirral only service, Wirral specific service.
Right.
Yeah.
Okay. That was the answer I wanted, Jane. Thank you very much. Thank you, Chair. Thank you.
Thank you.
I thoroughly recommend their website, Councillor Burgess-Joyce. There's some really.
I shall look at it afterwards. If you've really recommended it, Yvonne, that's good for me.
Information there, and they have a phenomenal repository of data, incredible data set, which is part of their national system, which is really useful.
I will have a look at it. Thank you, Yvonne. Thank you.
You should. Councillor Gilchrist.
Yes, well, I think I recall some of the issues at the start when this service was first sought, and the issue is having people who are independent enough and robust enough and agile enough to get into places, to get a feel for places that is not our staff or directly health service staff. I think back perhaps 30 odd years to things like community health councils, which I was associated with in the 70s, if I remember rightly. We had one for North Wirral, one for South Wirral. There were independent-minded bodies who could go in and look at things. Now, Councillor Burgess-Joyce mentions the annual budget cost, but if you take, say, 4 or 5 people with their salaries and their pension contributions and the on-costs and the overheads for some premises and supplies, then that looks quite an interesting fit. We'll have to see what they come back with. But unfortunately, you can't provide independence on the cheap.
Yeah, I think they only have 35 of them, I think, on Wirral. Their staffing is about 5 people. I think one of their very useful things they can do is their enter and view provision that they're legally allowed to do into care homes and so on.
It's quite helpful. Sure.
Really helpful. Any other hands up? Well, Councillor Gilchrist isn't down, but that doesn't mean it's up. Right. Okay. Thank you all. So, what is it you're looking for us to agree that the tender process can start and to agree the delegated authority to the director to award the tender?
Yeah, agreed.
Agreed? Is everyone agreed on that?
Agreed.
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 Thank
Can I
you.
just confirm that was seconded, Chair?
Can I have a seconder for that proposal?
Yeah. Happy to second that, Sam.
Thank you. Right. Okay. Thank you very much. And that moves us on then to budget reports, revenue budget monitoring. Graham, I assume?
It is me. We'd projected a very small overspend of £36,000. The key challenge during Q3, as set out in the report, was a significant increase in people needing support, primarily through domiciliary care services in their own homes, plus a number of people requiring additional support to keep safe, which has led to the cost of care by individual package increasing through 2020. This has been covered largely by additional COVID-19 funding that we received from government, and it has enabled us to offset a significant amount of those additional costs. Table 1 sets out the costs and includes a balancing figure, which is the reduced cost of our central functions or staffing costs, and that does offset some of the pressures as well. In terms of table 3, that sets out our capital position, and again, what can be seen is that capital has largely been dedicated to extra care housing, assisted technologies. But there have been some delays in provision due to limitations imposed by COVID-19, so there has been some slippage on that expenditure. So overall, this is a very positive position reported for social care and public health in what has been a very challenging year for Wirral Council as a whole. We have dealt with peaks and troughs of demand through the year and have supported the care sector to cope in extremely challenging circumstances. Thank you, Chair.
Thank you. Thanks for that, Graham. I would agree. I think it's nothing short of a miracle, really, that we've got to where we've got to, given the year that we've had. But before I make my comments, is there any other comments from committee members or questions? Director. There's a hand. Councillor Berry. Councillor Berry, going to speak to us?
Can you hear me now? Sorry.
I can now, yes.
Okay, thank you, Chair. Not quite sure if this is the correct opportunity to raise this or not. I'm sure you'll correct me if it isn't appropriate. Just concerned about after our budget meeting last night and looking forward to the future. Some of the concerns around Wirral evolutions, that we did set them quite a large target on the reduction, which was £500,000, and I don't know when we're going to see the proposals that have been put forward to save that money, but I think that as a committee, I think that we need to support Wirral Evolutions and the service users as much as we possibly can in order to help them make that saving. And I'd like some indication of when we could look at the proposals and on what those proposals will deliver. Thank you.
Graham, I know you can answer that one, so I'll leave that to you.
Thank you, Chair. So Wirral Evolutions are developing their proposals. They absolutely need to be sure that their proposals are ready to go out to consultation, both with the trade unions, should they be proposing changes to staff and any staff leaving the organisation, and also to users, carers and other stakeholders in relation to Evolutions. They are required to come and report back to committee in relation to the consultation process, and I'm sure that committee would want to see those plans and understand what's being presented.
Thanks. Thank you, Graham. Yes, I know our intention is, we've said all along that we will want to see them on a regular basis and to hear about progress on a regular basis. So I assume as soon as they are able to start their consultations, they feel able to, they think that they're ready, we would expect to hear about that in committee at that point. Okay.
Yes, I think the only difficulty in terms of timetable may be the gap between during the period when elections are taking place. So I'm not sure exactly what the consultation timetable would be, because Evolutions haven't aren't ready at this stage to consult. So as soon as we know that, we can work with them to set out the timetable.
Right, thank you. Thanks for that, Graham. Right, Councillor Gilchrist, then Councillor Collins.
Thank you, Chair. Yes, the Constitution Standards Committee the other night did discuss the draft committee calendar for the year, so that would be available to officers to see if those proposals that Evolutions have can be fitted in so that they would come to us at the right point. The other aspect of the committee work is that you, Chair, are particularly keen that we should get going the scrutiny committee, wrong word, but a subcommittee that's going to look at our finances and how money is managed during the year.
Monitoring panel is the word, do you think you're looking for, Phil?
That's the word I want. Thanks very much. The monitoring panel. So again, the monitoring panel might need to fit in with a certain timetable, a fortnight, 3 weeks before the ordinary committee meeting if its business comes to the committee. So I think if officers and yourself could give some thought to the frequency and timing of the monitoring panel, we can then make sure that we keep abreast of developments during the year. And it'd be helpful, of course, if the monitoring panel could have up-to-date information on capital so that we can see how assistive technology and other budgets are flowing through the year. Thank you, Chair.
Thank you. Absolutely agree. In fact, I've already said to the director that it would be helpful if the monitoring panel also got information on the capital programme, because I'm concerned about the slippage that we've had so far, and I really don't want to see that repeated going forward. Councillor Collins.
Thanks, Chair. It's something I presume we've all had a lot of emails with regards to Wirral Evolutions. I just want to ask the question. I believe that we have a space on the board level, board level position, and we have something to do with the shareholder committee. Now, what we're being told is one thing, as in we haven't taken up that position and we haven't convened a shareholder subcommittee for the last 2 years. If that's the case, can we look to ask the council, the officers, to actually get that moving forward? Because if we have got a member on the board, we're able to get a lot more information from them directly and quickly. That would be my suggestion, is we look at getting someone on that board if we've got a position there, and we'd have to come and ask the I don't know if it's full council or this committee's role to do that, but it's something that I think we should ask to do. Thank you.
As with many things in local authority, legal positions, Councillor Collins, it's not as straightforward as it seems, but I'll leave that to the director.
Okay. Well, firstly, just to say that matters in relation to Wirral Evolutions, the business, are matters for the council's shareholder board. There are elected members on the shareholder board, and their officers as well. They are responsible for the evolutions are responsible to the shareholder board in relation to their sustainability on their business model. So that's
Yeah, I do understand that. I wasn't expecting someone from this committee, but can we, as a committee, ask the council to actually? I think Phil Davis was the last person who was on the board, and it's been empty for some time. So I'm just saying, could this committee ask the council to put a councillor who is not on this committee on the board? So at least then we've got that level of continuity and a conduit as well.
Certainly, from my perspective, that question could be asked of the shareholder board to consider that approach.
Okay, thank you. Well, I don't, to you, Yvonne, I'm looking to you there. If we could do that, that'd be quite good, I think.
Yes, we can. I have had some discussions with Mr. McCourt around that, so we'll continue those discussions.
Thanks, Chair.
Thank you. Any other questions on the budget? And Councillor Gilchrist was absolutely right to say that I am keen to get our budget monitoring panel up and running. I think it's absolutely essential, and I do think that we should include the capital programme in it. We discussed this at the agenda briefing with all of the party spokes, so I think we have a general agreement on that, and we do need to closely monitor in advance of each committee that we are hitting the targets that we've said we will hit. What we don't want to do is to end up suddenly find in, November or December that we've suddenly got a huge amount of slippage. If we've got slippage, I want to know in June or July, not in.
Clearly, in terms of the 2021-22 budget, there will be a challenge in relation to the financial recording of budgets and the timeliness of those, because clearly today what you've received is a budget report from December, so they've come to committee a quarter behind, if you like, from the contemporary position. I do understand from the committee request that the nearer the report is to the precise contemporary position, i.e. as up to date as the report can possibly be, is the key ask. So I think that what we will do is we will make sure that we get the dates in for budget monitoring panel, that the panel will get as up to date a report as can possibly be produced at that point in time. In terms of the capital reporting, I think we do need to change the way that capital is reported, so that it's very clear to me, for example, in extra care housing, that there will be a large capital requirement that's held for a long period of time. Currently, budget reports will show that as slippage, but clearly we would not have expected to spend all of that straight away. So what committee will need is an expected spend against the capital over the year or over a number of years, so that committee can then see whether the capital is being spent at the point that it's expected to be spent, rather than us, for example, reporting slippage if there actually isn't slippage and it's going to plan. So I think that does require a different form of reporting in terms of capital. But again, that needs to be as contemporary as possible.
Right. So we're asked to note and note the 0.036 adverse outturn. Do I have a seconder for that?
I'll happily second, Chair, if that's all right.
Thank you, Councillor Gilchrist. Everyone in agreement that we note this report?
Happy to agree that, Chair.
Agreed.
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 Thank you all very much. Thank you to the Director for that. That noted. And that takes us on then into our section C, our performance reports, which I assume is Jason.
Thank you, Chair. Good evening, members. So this report is a regular report that provides an update on performance in relation to the adult social care provision. It's recommended that the Adult Social Care and Public Health Committee note the content of the report and highlight any areas requiring further clarification or action. The main body of the report is attached as Appendix 1, and it's dated 28th of January 2021 and is at page 53 of the electronic pack. So just a couple of areas to highlight for members. Numbers of care home residents do remain relatively stable at the time of the report, as does the vacancy rate, which was approximately 16% of total care home beds in Wirral being vacant. Also, the domiciliary care provider market continue to respond very well and have still delivered over 16,000 hours of home care delivered in people's homes on average per week. So that's a sustained high level of provision for people at home. So the report's there for members to consider, and I'm happy to take any questions that members may have.
Right.
Chair.
Well, I've got hands up for Councillor Collins.
Chair, we're having we've had some comments in the chat about there being a potential issue with the webcast. So are we okay to just pause for a moment while Vicky looks into it? Is that okay?
Yes, that's fine. Thank you. Welcome back, everybody, and particularly Jason, hopefully without an echo this time. If you'd like to carry on, and I've got hands up already from Councillor McLaughlin and Councillor Jordan, if you want to carry on with your presentation, Jason.
Oh, sorry. Are you ready for questions, Jason?
Thank you, Chair. Yes, so I'm happy to take questions from committee
It's more a clarification, really.
Oh, sorry, I didn't finish.
Oh, sorry. I do apologise. Tell me when you're ready for me.
I thought Jason was still talking.
No,
he's talking
you're
about care homes.
I think he said any.
You were talking about care homes.
So, Chair, I'm not sure if there were sound issues whilst I was presenting. I mentioned that members may be interested to see that the number of care home placements remains relatively stable, and that the vacancy rate for Wirral care homes is at a rate of about 16% of all care home beds in Wirral at the time of the report, and also that domiciliary care providers are continuing to provide on average over 16,000 hours of care per week in people's homes, which is really positive. The report is there for members to consider, and I'm very happy to take any questions that members may have.
Would you like to turn to the
Yeah, I'm sorry to jump in there before you were ready to take questions, Jason. It's just around the long-term residential home figure. At 600, to me, seems high and consistently high, given that there's a lot of work going on to try and reduce that. Could you just outline for me what is being done to try and bring that residential figure down, which should be a one that was easier to address by other means of providing care than more expensive residential?
Apologies, Councillor McLaughlin, are you referring to the total number of care home residents?
Total number of long-term residential, sorry.
Yeah. Yes, thank you. Yes, so the approach is always home first and to support people to return home. So the level of domiciliary care provision does demonstrate that the vast majority of people are supported in their own homes. A lot of care home placements are started at the point of hospital discharge, and the hospital discharge team are very sure of their priority to support people to return to their own homes as soon as they're medically fit and able to. So the vast numbers of people leaving hospital do go back to their own homes with or without support. So over the years, we have seen a gradual reduction in the total numbers of new care home placements, and we do continue to see that with the focus on reablement and supporting people's homes. The rate is still higher. The number of care home residents in Wirral is still higher than what we would like to see, and we do continue to focus on supporting as many people as we can to remain in their own homes.
Thanks, Jason.
Thank you. Councillor Jordan.
Thanks, Chair. Evening, Jason. I've just got a couple of questions around the CQC inspections. Not long ago, we had a spreadsheet detailing all the CQC inspections that had taken place. And when I look at it in a bit more detail, I see that something like 12 of them were from 2017, which is a bit concerning. And quite a few were from 2020 and 2021. The majority of those after the lockdown, and I'm just wondering how those inspections took place. There's also one that's just labelled as new approach. That was in 2020, certainly after the lockdown, but it doesn't tell me what new approach means.
So thank you, Councillor Jordan, for the question. I think it may be helpful if we provide a little bit more detail to members as to how the Care Quality Commission have been inspecting homes throughout the pandemic, how many of those visits have been physical on-site visits, how many of them have been remote visits, and so on. So I think it may help if we provide some additional detailed explanation as to how inspections have taken place up to this point, if that's of help to members.
Yeah, I'm sure it would be of help. I recall that I asked exactly that question when that spreadsheet came out a couple of weeks back, and I got an answer saying that they had been undertaking physical inspections. They had actually been going in to care homes with all the appropriate precautions. Is that right?
That's my understanding, Chair, and that there is a caveat to that in that their physical attendance in care home establishments has been very targeted to focus on the specific areas of underperformance that they've been highlighted for them to look at. So the range and depth of their inspections, if you like, may not be what they would normally be under usual circumstances, but they have been attending care homes with all the full protections in place as you've outlined.
Right, thank you. Councillor Cannon, then Councillor Berry, then Councillor Gilchrist.
Thank you, Chair. It was really a thank you, Jason. I think the fact that we've now got the end of reason for service package ending for reablement has been really insightful, and I think it was something that we talked about, and I think it actually gives us and the public a real sort of grip of what it is that we're actually providing and for how long that we're doing that. So I think it was a thanks, really. I mean, the reporting is superb, but this particular has kind of really brought home about what we're offering the public, what we're delivering, and how good that is. So thank you very much. It was more of a thank you than a question, Chair. Sorry, thank you.
Well, thank yous are always welcome, I'm sure, to all of our teams. So thank you for that, Councillor Cannon. Councillor Gilchrist.
Thank you, Chair. I've got a question, and then people can tell me I'm not understanding the tables correctly or give me some advice if I may. The papers are numbered page 70 in big type or page 20 in small type in this report, and it is a table about the care market, section 5.0 and 5.1 domiciliary care cost and hours. So I'll just give Jason the opportunity to get to that page, and it has columns about hours delivered and hours commissioned, and the hours delivered always seem to be quite a bit below the hours commissioned, and I don't understand the discrepancy. I'm sorry. Perhaps there are a lot of people on standby but might not actually be called in because the hours delivered might not need to be delivered if somebody is in hospital or somewhere. There might be a perfectly logical reason for the difference, but I wondered if you could explain it. Thank you.
Yeah.
Thank you, Councillor Gilchrist. Yes, so how we arrange our payments to care providers in the domiciliary care sector is paid for the actual care hours delivered. So in a very brief summary of what is perhaps quite a complex process, a social worker, for example, might arrange a care package of, say, 3 half-hour care visits per day, 7 days a week. But over the time of the care package, the care provider may not need to provide every single visit or every single visit for the same duration, depending on the person's circumstances, how they are that day, what they're managing to do for themselves that day, or perhaps if family members are visiting and can undertake some tasks on 1 or 2 occasions. So the commissioned hours is what we put in the system, if you like, in terms of what we ask the care provider to do, but we only actually pay them for the actual care hours that they deliver and that they invoice us for. So it's usual and normal for the commissioned hours to be higher than the actual hours delivered. I hope that makes some sense to you and answers the question.
Oh yes, it does. Thank you very much. Thank you for that. I'll explore that more conveniently when we panel. Thank you.
Thank you, Councillor Barry.
Thank you, Chair. Thank you very much. Jason, I have a question relating to the graph on page 85, I think it is. Yep. And it's the setting of KPI number 3, and the heading is percentage of safeguarding inquiries concluded within 28 days. And I noticed that on the traffic light sequence, there's a great deal of red on that particular chart. I'm wondering what are the issues to do with safeguarding, and how come they've deteriorated over November, December, right up to year end? Thank you, Jason.
Thank you, Councillor Berry. Yes, and I believe members did highlight this and comment on this perhaps at last committee. So the safeguarding inquiries being completed within 28 days does rely on the whole process being concluded to a point where the safeguarding inquiry can be closed. So this does rely on partners in the health and care system and wider partners such as the police, for example, and a number of inquiries do take longer due to the complexity of the case or the requirement for involvement of processes and procedures by third-party organisations. I think we've provided some very high-level data to committee members as to the main themes that lead us to this position. It is expected that not all safeguarding inquiries would be completed within 28 days, but it's finding the right balance between what's a good response and what's not such a good response. So the numbers that we see completed within 28 days in this report aren't as high as we would like, and the social work provider teams are actively working on how they can improve that position, albeit that there will always be a number that take longer.
Thank you. Thanks very much, Jason.
Councillor Cottier, then Councillor Collins.
Yeah, thanks, Chair. It's probably just going on from what Bruce has just said then, Councillor Bruce. I asked about the data or any data available about notifiable incidents, reporting and outcomes, just to give us an idea of how we compare pre-COVID to where we're at now. And the spreadsheet that was sent would, it'd indicate that there may be a few issues in that, but coupled with hopefully some data that you might have. I know it wasn't that long ago, and you obviously you've got to try and compile it. I appreciate that, Jason, and appreciate how busy you've been. But if there is anything that could, be tallied with the data that you've already presented, which is excellent, thank you. But it does, unfortunately, the more data you send us, the more questions get posed, isn't it? So it's kind of a double-edged sword for you. But it does. I had a few concerns last time with the lack of that data, and the data that you've presented since would probably increase my concerns, to be perfectly honest. But if there is any data out there, I'd really appreciate it if that you could get it to us.
Thank you very much, Councillor. First of all, I would like to say that we very much welcome the interest and involvement of members in understanding and scrutinising the performance data. So it's very welcome. We are looking into that, and we will definitely undertake to provide some data to members of the notifiable incidents and any patterns or themes that we've seen, particularly throughout the last 12 months or so. So we will undertake to provide that, which may well be interesting to see alongside the performance report data.
Thank you, Chair.
That was impressive, Jason. You managed to say that about welcoming our scrutiny of data as if you actually meant it. That was really good. Well done. Councillor Collins.
Thanks, Chair. Thanks, Jason. Made up seeing the report. There's a lot of information there, as our colleagues have said, which then gives us loads of questions. One question I've got is, well, I've got a couple of questions. One is about safeguarding inquiries, but do we know, I know you've said about the reason we're falling behind because it's partners and everything else. Do we have a way of checking the quality of domiciliary care providers and the care that is provided to our residents? Because I am aware of a couple of occasions where I've been contacted by people who've had to change care providers. Is there a process that we're checking those providers, making sure they are keeping up to standard? You may know this, this answer may be already there, but as a newbie to the committee, I just need just one question I've got.
Yes, thank you, Councillor Collins, for the question. We do. We have the contract monitoring arrangements for the care providers generally, but we also have a system within our case management system whereby staff working in the sector, in the social work teams, can report any care concerns that they have through our systems. So our quality improvement team use that data to look at the nature and the number and the themes of care concerns that are raised. And they also meet regularly with health partners in surveillance groups to look at the overall quality in the sector. So we do have a process in place, and it does rely on people alerting us to care concerns where they do occur, and then our quality team do look at those.
Just supplementary to that, so if you've got a company that has produced concerns for one client, do you then go and look at other clients that company provides for to ensure that the care for them is right, or do we just deal with the concern that one client has got?
So yes, it very much depends on the nature of the incident and the number of incidents reported. Often they are cases where we can ask the provider to address the issues and inform us of how they've addressed it, and then we can check. But sometimes, and unfortunately, as we know, there are some care concerns that cause us to have more concern around wider care provision. So in those cases, we do targeted reviews with our social work teams of particular providers or particular establishments to understand how safe people are and the nature and quality of care that's provided. Sometimes that's under safeguarding arrangements specifically, if it warrants it. Sometimes it's part of a wider overview of the care concerns that are raised.
Thank you, Jason. Thank you, Chair.
Thank you very much. Councillor Cottier, is that a legacy hand, or have you got another question?
My apologies, Chair, it's a legacy hand.
Okay, thank you very much. Right, so are the committee happy to thank Jason and to note that report?
Agreed.
Yeah, thanks, Chair.
Jason.
Thanks, Jason.
Thanks, Jason.
Thank you.
Can I second that, please?
Yeah, Chair.
Oh, well, there's a whole host of seconders. Take your pick. Right, that brings us on then to the strategic developments in the NHS, and I'm not sure if the director's doing that with the Simons here. Simon.
I'm here, Chair. Thank you very much. As with other presenters, I'm presuming that people have read the paper. It sets out the main headlines from the white paper produced last month, which is called Integration and Innovation, Working Together to Improve Health and Social Care for All. As with any white paper, it's a precursor to legislation, which was it's the intention, we understand, of the government to take through Parliament in this calendar year. The key measures within the white paper are to bring NHS and local government together on a more legally established footprint, to remove the requirement for the NHS to tender for services and reduce that to only when there is a potential that would lead to better outcomes, so that removes the competitions and markets authorities influence within the NHS, to make sure that the healthcare safety investigation branch is put into law on a statutory basis, to improve new measures of oversight and accountability for social care services, which are still to be developed, but also to introduce legislation around calorie labelling on food and drink packaging, the advertising of junk food before the 9 PM watershed. Two forms of integration that are proposed within the white paper are integration within the NHS, and secondly, greater collaboration between the NHS and local government. And this is aimed to support place-based joint working, so aligning commissioning with an integrated care system and then subsequently with a local authority boundary. This means that the proposed clinical commissioning groups will be abolished and their functions will be subsumed into a statutory integrated care system, which will have two bodies. It will have an NHS body and it will also have a health and care partnership through which it will interact with local authorities. Clearly, as a white paper, the detail on this legislation is still developing, but as I've said, some of the key things the merger of NHS England and NHS Improvement into one body, but also enhanced powers of direction for the government over that newly merged body, and the power for the government to transfer functions between bodies and develop new assurance frameworks. There is something also hidden with it that's quite important, the idea of discharge to assess models to stay. So during the COVID crisis, we have worked in terms of a discharge model which involves community trust pulling people out of the hospital setting within defined eligibility criteria, working with the local authority. And there's a proposal that will be there to stay, which gives 6 weeks for health and care to assess people in terms of the appropriateness of their care. Taking the process of fluoridation of water to a national level through central government, and a number of other measures are therein. As I said earlier, on current timeframes, subject to parliamentary business, the government's plan is the legislative proposals will be implemented which by local authorities would fit in. There should be maximum local flexibility about how integrated care systems are constituted and how they make their arrangements locally. And a number of us are engaged in obviously pushing forward the whole idea of Wirral as a place. The final one is actually that the ophthalmic and community pharmacy services is then delegated by NHS England to the appropriate local integrated care system body. So these are proposed changes. As I said, it's a white paper, so it's therefore out for consultation and for people to put their views into government. But we are anticipating a draft bill in the late spring and it to follow through the legislative programme. So it's there for information, and it follows on from the paper I presented last time and the recommendations that you approved that are set out in the minutes of this meeting. Happy to take any questions and answer as best I can.
Thanks for that, Simon. Are there any questions for Simon at this stage? Councillor Gilchrist, then Councillor Jordan.
Thank you very much. I think I'll get my camera on. I think the key issue for Mr. Banks as a key local figure is all the staff that work with him. And you'll forgive me, Simon, if I ask about this letter that's mentioned on page 101 in section 3.3.3, and this is the employment commitment. I think I've mentioned before that I would be not very pleased if people had to go, take their skills and we lose their skills, but equally not pleased if there's a whole restructuring exercise that costs money. So I'm interested in how all the relationships we've got with people who work with us in Wirral, how they can be maintained and how those individuals can be maintained where they want to stay, so that we have this structure that's with officers who are familiar to us and our officers in Wirral, that remains and can work forwards beyond this. As I said, in some places it looks as though some things will go up and some things come down in this new structure, and naturally as Wirral with a place, we'd like to see as much in direct contact with us as possible. Thank you.
So we're aware that an employment framework will be coming out sometime during April, potentially May. As it says in the report, there is an employment commitment being offered to the people below board level. You can't offer an employment commitment to people at board level simply because their roles will change, they will become redundant. You don't need 6 chief officers across 9 CCGs if those CCGs don't exist. But we understand that nationally the human resources team working on this are wanting to set out something that seeks to retain skills, experience and expertise of NHS people in the system, but they can only, I suppose, offer that full employment commitment to people below board level. What we're doing in terms of working with the local authority and the emerging integrated care system, Cheshire and Merseyside, is very much putting forward the case that you've just made there, Councillor Gilchrist, about we want to retain people who know Wirral within Wirral, and to continue the work that we've developed with the council around integrated commissioning at place going forward, and we feel that's being received very, very positively by the Health and Care Partnership and by NHS England.
Well, thank you for that.
Thanks, Simon. Councillor Jordan.
Thank you, Chair. Simon, first of all, can I ask you, when we talk about place and in terms of place-based commissioning, we hear of Wirral and we hear of Cheshire and Merseyside. Is place-based commissioning going to be done across a Cheshire and Merseyside footprint or across a Wirral footprint?
So it will depend on where the functions are best discharged, but the definition of place in the integrated care next steps engagement document last November, and the continued definition of place is the local authority boundary. So that will be defined by the area which your health and wellbeing strategy is set up, your joint strategic needs analysis is done. So that is upper tier local authority, i.e. Wirral. There will be some things that the NHS will want to do at a level beyond Wirral, but the issue is actually we need to make sure there's connectivity across them. So I've said to you before, my involvement in learning disability services. Over the last few years, we've managed to reduce inpatient numbers through a mixture of focusing on reducing admissions and improving discharges, and that has been done at a Cheshire Merseyside level, but supported by local action. So local intensive support teams, good supported housing locally, and things like that, and working really closely with local authorities. So those things need to happen, both at a local area and at Cheshire and Merseyside, and indeed are planning around some elective care services, cancer and so on. It needs to have the intention is certainly the Health and Care Partnership under Alan Yates and Jackie Bennett, and the discussions that they're having is that the majority of functions will reside within Wirral, and certainly that's how we're shaping our response to this. Safeguarding is a very good example. You can learn a lot by sharing information across a Cheshire Merseyside footprint, but it's best delivered locally alongside the local authority who has responsibility for it and for those local people.
Yeah, I understand that, but what I'm concerned about is something like rehabilitation, in particular sort of specialist rehabilitation, which currently level 1 is at the Walton Centre. Level 2 for north of the river is in St Helens. Level 2 south of the river doesn't exist. So there's an inequality for Cheshire and Wirral. And I'm wondering if the ICS will actually give us the chance to have rehab this side of the water.
Yes, and there is some work ongoing around rehab, particularly sort of the neuro rehab you're referring to, Councillor Jordan. And we'll have to look at levelling up in terms of dealing with those sort of inequalities of access across Cheshire and Merseyside, and therefore there'll be the resource we'll have to follow to correct where that needs to happen.
Thank you.
Thank you very much. Thanks for that, Simon. It strikes me that this is really, really helpful and very, very useful paper. Thank you, Simon. It's clarified a lot. And clearly there's a lot of implications for us as a local authority in this, as Simon's mentioned a few times. Graham, I wonder if you could bring a paper to the next committee, perhaps, looking at the local authority implications of these changes. Is Graham still with us?
Yes, Chair, yeah. I'm here. Just took me a second to take my microphone off. Yes, Chair, happy to do that.
Okay, thanks very much. Any other questions for Simon? I need to say then, thank you very much, Simon. Really, really helpful. I'm sorry that you had to wait till near the end of the agenda. It's just one of those.
No problem, Chair. Thank you.
Anyway, it's good to see you. So thank you very much indeed for that. Really useful. Okay, and that brings us then to Julie, who's also had to hang around for our COVID-19 response update. Thank you, Julie.
Thank you, Chair. I'll just bring the committee up to date with some of our latest data. You have got a link within the paper to the website where we publish our weekly report. But just to let you know that up until the 24th of February, we had 318 cases reported in the 7 days to the 24th of Feb. The previous week we'd had 371. Which means that our 7-day case rate has come down from 115 per 100,000 to 98 per 100,000. So that's really good that we're down below 100. Our positivity rate has come down as well to 3.7%. The majority of our cases, though, are in our working age group, so the 20 to 59 years. It's also good news that we're seeing within the hospital a real change in the number of people in the beds there. So on the 1st of March, there were 29 people in Park Hospital with a positive COVID diagnosis, which was down from 42 in the week before and from the peak of 279 on the 22nd of January. So all our data is going in the right direction. But, and I will keep saying this, I'm sure, for some time, our case rates are still very high compared to where we need them to be. I would like to see them to at least down to a rate of 25 per 100,000 before many of the lockdown measures are released. Having said that, the roadmap from the Prime Minister was welcome. However, it won't be a straight line for us from here until the 21st of June. There are definitely going to be bumps along the way because, as we know, this vaccine hasn't gone away, despite the best efforts of the vaccine rollout, which is doing a phenomenal job. And Simon, working with primary care colleagues particularly, we've now seen over 66% of the eligible population have their first dose. And we need that take up to be high and to keep it at that level. The testing offer that we've got within the borough has developed phenomenally. I was thinking back to March last year and how what a different space we're in now with regard to the testing offer. But there's variants that we know have been reported nationally that will be challenging the vaccine and challenging the transmissibility as well. We've also got schools returning next week, which is really good news, but that will mean more mixing of adults, and we know that the virus likes it when we mix together. And of course, on the 12th of April, according to the roadmap, the rule of 6 will be reintroduced, which again will lead to more mixing and therefore more opportunities for the virus to circulate. So I suppose the message from me really with this report and in all the other comms that I'm doing is that we all just need to keep vigilant. The paper outlines all the work we're doing to support the easing of the lockdown measures. And don't get me wrong, personally, I really want these lockdown measures to be removed, but professionally, we need to keep these in place for some time. So the paper outlines the work we're doing for the easing of the lockdown and how we're prepared to deal with any outbreaks, and we will see outbreaks. So just a few final points from me with regard to the report. We are currently updating our outbreak plan, which we will obviously bring to the committee. Within that, we'll be talking about the new testing strategy, which is moving a lot more towards testing in the workplace, testing at home, again with a outreach facility for areas of high prevalence and any outbreaks. Also commentary in there about how we work with the NHS around the vaccine rollout. I'd also like to highlight to you within the paper the work around the engagement and comms team. Just this morning, the team were reporting to me about the insight work that they've done with men aged 20 to 39 who we have found have been reluctant to come forward for testing, and that insight's going to help us to shape the offer that we provide, particularly for men in those age groups. Next week's going to be a busy week as well for the schools team within the Outbreak Hub, and we're prepared for that. We've worked really closely with the schools, and the head teachers have been amazing in the way that they've responded to us, but it's going to be a busy week just because things will be changing yet again. So thank you, Chair. They're just some of the highlights from the report. Thank you.
Thank you very much for that. That's really helpful. There are a few questions. We've got a few more minutes left. Right, I'll start. Councillor Collins, I think, was first, then Councillor McLaughlin, then Councillor Cannon, Councillor Frost, and Councillor Gilchrist. Yeah. Okay.
Thanks, Chair. Thanks, Julie, for that report. It's more of a comment than anything. I took my father down to have his first vaccination to Woodchurch Leisure Centre, which was well and truly, it was fantastically run. It was well supported. I had the opportunity to get my vaccination about 4 weeks ago due to health conditions. And what I can say is the way the vaccination centres are being run, I'd like to just put on record my thanks for everybody who's been doing it, from the volunteers through to the NHS and to the doctors and GPs who are doing it. It's really, really great to see the communities are pulled together to actually get these vaccinations out. So I just like that recorded, that, you know, thanks to all those who've been involved in the vaccination programme on Wirral. It's been fantastic. Thank you.
Thank you.
Thanks, Councillor McLaughlin.
Thank you. And mine also, Julie, is a comment. First of all, on the face, good news and good progress so far. Obviously caution and some way to go yet before we can really breathe easily. But I would also like to congratulate all the staff that have been involved, from the people doing the vaccinations. I had lucky enough to have mine vaccinated. It was a very, very streamlined experience, and I really do encourage everybody to take advantage of this, but also those that are supporting the not only the health of people in the borough, but also those that have had their livelihoods affected. There's been some really good work gone on through the hub and supporting people who are in need. And I would just like to say thank you very much to everybody involved. It is almost superhuman, the effort that's gone into this. And I know you're not out of the woods. I know we're not out of the woods, but I would again like to pay tribute to you all and your staff, Julie. And you don't suppose you ever expected to be confronted with this sort of thing, and you've stepped up to the plate wonderfully. So thank you so much.
Thank you. Thank you.
Thank you, Councillor McLaughlin. Echoed by all of us, I think, those comments. Councillor Cannon.
Yes, absolutely. Echoed all of those comments, Julie. Thank you so much. We had a briefing that came out late on this afternoon about lateral testing. That is now, you won't need to have a PCR test with a positive lateral test. And my question, having issues trying to get family members into respite unless they'd had a PCR test rather than just a lateral test as being negative prior to being admitted into respite. So I think my question was, are we going to really push the comms that now that we're happy with just a lateral test, either negative or positive, depending on the result? And then secondly, was just around vaccines. Again, some sort of communication that we've had, which is probably more appropriate for children's, but I will mention it here because it crosses over, where our special needs teachers in special needs schools have been vaccinated, but our teachers who work in schools that have special needs hubs haven't, and there's been some issues around that. So it was just those two things. I don't expect you to answer them, but it was just those queries of, especially with the lateral testing, can we really promote that? Because I've had some very upset residents not being able to get family members into respite. Thank you.
Okay, can I come back on that, Councillor Nolan?
Yeah.
So, Councillor Cannon, can you please send me the examples that you've got around respite care? Because
absolutely.
Yeah, so we can absolutely sort that out. And with regard to the SEN staff in mainstream schools, we're having a meeting tomorrow afternoon with Paul Boyce and Simon Banks to discuss that further.
That's really heartening. Thank you very much.
Thanks.
Thank you. Right, Councillor Frost is next.
Thanks, Chair, and thank you very much, Julie, for all your work and also for the kind of transparent and regular open information sharing with us. I know a number of residents who've been in touch who on the Community Champions have really appreciated the email blasts and then being able to pass that information over. My question was just around, we spoke about it before, and I know, having read through the report, it's obviously front of mind for you as well. In terms of reaching out to, we've had a lot of national news around reaching out to BAME communities to debunk some of the kind of the vaccine myths and the sort of the fake news that's circulating. It would just be good, I think, to get a Wirral update on that in terms of how you're facing, or how much of a level of that problem nationally that we're facing on Wirral and how you and the team are tackling it.
Thank you, Councillor Frost. Maybe next time I come to talk to you, I can we can perhaps focus on the work that we're doing with the BAME groups. Yeah, I know certainly the primary care network in Birkenhead, they did, I'm probably going to get this wrong, but they were definitely, I think it was WMO, we're a multicultural organisation, that they delivered some vaccinations out of this week. So people are trying to use every single avenue that's available for them. So, but I will bring an update to the next committee meeting on our work with BAME groups.
Perfect, thanks, Julie.
Thank you. Then I've got Councillor Gilchrist, then Councillor Usher, then Councillor Burgess-Joyce.
Thank you, Chair. Well, after all the worries we had last year about test and trace and tracking and so on, vaccination is the now bright ray of sunshine, ray of hope right into the whole situation that we've had and faced over the past year. So I'm really grateful that those people who are organising it have got it right, and that it's working so well. Certainly when I went to the Oval, I was impressed by how well organised it was, how welcome people were made, how everything was being carefully cleansed. So I didn't go in my gardening clothes, I went dressed reasonably, but the chairs were wiped each time anyone moved. They were then cleared once people had gone, and once you'd sat in the waiting area for the quarter an hour before going, once you left, everything you'd sat on or touched was cleaned thoroughly afterwards, which just shows how well organised everything is. And I'm sure every resident in Wirral who's had the vaccination has had similar experiences, and those who haven't had it yet ought to have the confidence that everything is being done on their behalf. I just want to look at, you may know, I think some members know, certainly in the latest meetings, that I pore over the Public Health England website and look at the super output areas every other day to see how things are going. And in each of those groups of 6,000 or 8,000 homes in Wirral, we're now, if we see 6 or 8 or at the outside 10 cases in any of those 43 areas being reported in several days behind, then that's a great relief compared to the 60 or 70 or 80, even more cases we saw in each of those areas perhaps only 2 months ago. One particular geographical area in Wirral I have noted recently, I don't want to name it here, but shall we say in the northeastern corner there appears to be quite a concentration of a higher level of cases at the moment, and there may be or may not be particular reasons for that. So my question is that because the Public Health England data that I as a citizen see on their website is always behind, whether your staff, your team are getting it early enough to go and investigate what's happening in those areas. You're not relying on the national stuff that comes down, but you are able to get in and see where things might be not working as well at the earliest possible stage. Thank you.
Yes, Councillor Gilchrist, I can assure you that we're now getting daily line data of the number of cases that we have within the borough, and therefore we then follow that up if we believe there's a particular issue in a particular setting, whether that be a workplace or a care home, for example. So yes, we're now getting daily data with regard to our cases.
Thank you. Something to follow up, if I may. I saw television,
because it's now 5 to 8.
Television news item last night, particularly concentrating on food factories in the Kent area, the salad plant that had to be closed by the Health and Safety Executive. Are we continuing our work in visiting local food manufacturers to check that everything is in order there, especially production lines?
Yeah, we certainly are, and I think that's one of the real. There are some I wouldn't say a benefit, but some of the positives that have come out of coronavirus and the work of the hub is the connections, I think, between looking to see where the cases are, environmental health, going out and having those conversations, linking it with the proper comms, linking it into a testing offer if that's appropriate for those premises. So yes, we've got a much more joined up offer now, I believe, around support into businesses.
Thank you very much.
Thanks for that. Thanks, Julie. Councillor Usher. Again, can I just remind members that it is now 5 to 8?
I'll be very brief, Chair. So just again, echoing all the thanks, Julie. It's been an unbelievably huge task, and sure you have everyone's thanks on the committee. My question relates to Councillor Frost's comments about some of the misinformation out there. Obviously, there are different levels of misinformation, some of which we just need to sort of assuage anxieties, some of which we need to forcefully respond to. And I wondered if we had a small document or sheet that we could send, or the public health could send to our care providers. Obviously, the staff are in one of the most significant groups, and it's a case of diminishing returns at the moment, because I think most of them have been vaccinated. But I am aware, working in that environment, there are still a small number of staff members who may have anxieties, and of course, they could speak to their managers about getting reliable channels of information about the vaccine, but the services are running quite flat out, or have been over the period. So just a resource, an information resource of that nature that could reach a large number of people, just by circulating it through our largest sort of providers would be really welcome and useful. Thanks, Chair. Thanks, Julie.
Thank you. And councillors, thank you for all your kind words around the vaccine programme. I feel like I really do need to say that that's very much an NHS-led programme, which we are obviously supporting significantly. And I will take the issues back around the comms, Councillor Usher. I think this is an ongoing issue. We always have this with vaccination programmes. And we absolutely just need to keep pushing out the facts around this vaccine. And I think that the evidence that's coming through is very much showing that those people that have been spreading mistruths are really not doing the population as a whole justice. But I'll definitely take those issues back into the vaccination group, and we'll work on that. And just with regard to BAME groups, tomorrow through the Health and Care Partnership, I know there's a workshop on insight work they've done with BAME groups that we're going to be using locally to help to shape our response. And I know local BAME leaders have done some of the videos for it and have taken very much a leadership role in that. So thank you to them. Thank you, Chair.
Thanks. Councillor Burgess-Joyce.
Hello, Julie. I'll keep this very, very brief. I'm conscious of time. Councillor Collins and I attended the Hoylake Hotel last Thursday because the residents there had been set loose from the hotel because of various accusations by the hotel owner. Long story, won't bore you with it. And we obviously went there to try and intercede and get them back in the hotel. It did raise the question, have they been offered any facilities as well? Obviously, we're talking about BAME. Some of them may have pre-existing conditions where they are entitled to have a vaccine.
Yeah, it's certainly an issue we've raised with the CCG, Councillor Burgess-Joyce, because we were very conscious that they were a vulnerable group of individuals and therefore needing to make sure if they were eligible that they were having their vaccination. So that is something we've taken up with them. Yeah.
All right. Thanks, Julie, and take all the credit, Julie, because you deserve it.
Thank you.
Yeah,
Thanks, Chair.
I think we'd all agree that's the very least we can do in that absolutely appalling situation that went on in Hoylake. The very least we can do is ensure that whatever protection we can support them with, we will do so. Councillor Jordan.
Thank you, Chair. I'll try and be very quick. Thanks, Julie, for all your hard work. Chris Whitty recently said he saw it as a professional responsibility to have the vaccine. And I know we in the NHS had loads of reminders across the screen, non-stop, and then we finally come to an end because we've done the first round. I just wondered if you have any details on the uptake amongst care workers.
We are collecting that information, Councillor Jordan. Yeah, I haven't got it to hand tonight, but we are, we keeping a watching brief on that, definitely.
Thank you.
My understanding from meeting I was in the end of last week, I think Graham was there as well, correct me if I'm wrong, but I think the report from Simon was that we had around an 80% take up amongst care workers in comparison to a 90-odd% take up amongst other groups, which is very concerning, and I think is obviously something that people would want to work on. But that's my recollection. I'm sure Graham can correct me if I've misremembered that, but that was...
My only concern is that when relatives are placing their loved ones, that they need to know these things, and that should be something that they can look at as part of the metrics for that particular residence. Yeah,
well, I do wonder, given that, for example, people working in certain areas of the health service can't work unless they've got a Hep B certificate, whether or not we're moving to the point where we say that your vaccination certificate to say you've been vaccinated against COVID is a requirement in certain areas, and I think we definitely consider. Okay, well, Graham obviously doesn't remember that figure any more than I do. He's not going to argue with me, but I have a feeling it was around 80%. I'm sure I've probably got notes somewhere. Any other hands? No. Okay, thank you very much, Julie, and as ever, thank you, and keep up the amazing work. Thank you. Right, that brings us now to the next item, which is.
Can I just confirm, Chair, we've moved and seconded that matter?
Yes, I'll move the noting of that report.
Happy to second that, Chair.
Thank you, Councillor Jordan. Right, the social care and public health work programme, which I'm told has to be on there, although we have agreed, and again, I think we confirmed it at our spokesperson's meeting that at this moment, given that we've got a reduced agenda and that we are having to be flexible and respond to the demands of the COVID situation, that we were not going to at this point make any formal plans for our future work programme. That was agreed amongst the spokes, but I'm happy to take any different views on that if there are any. No? The recollections are the same as mine then. Okay, so we will, I don't quite know what we do with that, Vicky. Do we just...
I think we just note the current work programme, Chair. So if you're moving that, if somebody seconded.
Yeah, I'll move that. Somebody can second it.
Second that, Chair.
Thank